Hello everyone, myself Ruchi Patel, working as an assistant professor at LJ College of Physiotherapy. Today I am going to take second year topic, that is ergonomic tips for the computer users. Basically, ergonomics is the Greek word and which has two words which contains nomai and ergon. Nomai means the natural law and ergon related to the work. So, ergonomic is the scientific study of the human motion. So, in other way, we can say the scientific study of people physically how they interact with their work fitting to the job and the equipments and the work environment. So what usually people do while working on the computer? They'll not bother about their posture and knowingly or unknowingly, they are putting their body in a stressed position. So here you all can see this person has a excessive forward flexed position of the neck as well as back is also in the forward flexed position. The legs are not supported as well as forearm is also not supported, wrist is getting more compression, and the sitting area as well it is not in a proper way. So as a result, the person has to suffer with the MSD, that is Musculoskeletal Disorders. So here there are few examples which the computer users are getting the issues while working on the computers for the prolonged period of time. The person might get the vision problem, might have upper back pain issues, tingling and numbness sensation in the palm and in the hand, lower back pain issue, pain, headache, then discomfort, fatigue, sometimes in the thumb pain, lower extremity, leg pain, or sometimes swelling in the lower extremities, as well as sometimes knee pain, tingling in the hand, numbness, reduced range of motion, loss of strength. So, creating a good ergonomics working arrangement is important to protect individuals' health. Working at a computer can cause back pain, neck pain, shoulder pain, headache, eye strain, overuse injuries of the arm and hand. So individual can avoid this computer related injuries with the proper work environment as well as with the proper posture and with the good working habits. So what are the benefits if the person follows this ergonomics? As you all can see in this diagram that there will be the increase the productivities of the work. Then in the downward side, this down arrow is indicating the decreased chances of the injuries. There is increase in the quality of work. That is decrease the amount of that time which they face the issues related to the pain or might because of that they'll take more time to perform or to complete the task. Then overall employees morale get increased and it will be the cost effective type of advices so that it can reduce the future injuries. So what are the common problems which computer users are facing? Mainly muscle soreness, muscle fatigue are the main complaint. Other than this, back pain, chest pain, knee pain, and numbness in the arm, shoulders, feet pain. These are the common injuries like wrist pain, upper back pain. It's the most common type of injuries. Sometimes due to the poor posture, shoulder pains are also have a patients have complained. Headache is the common issue. Then we can say this is the repetitive stress injuries. When we work on the computer and we use that muscle in an awkward position for a prolonged period of time. So, as a result, the individual may experience stiffness, pain, swelling in that particular area, and twisting of the wrist to use the mouse, or specific typing techniques that causes the stretching of the fingers, or we can say that long finger flexors has to work at multiple joints at the same time, so it might get stretched a lot, and it gives the pressures on the wrist also. So, as a result, the person might have to suffer with the carpal tunnel syndrome. Vision problem continuously by seeing the computer screen. They might have the issues related to the visions, the bright light and bad glares, or the flickering images can strain the eyes, and constantly focusing on the screen without blinking can also make the eye dry. So another issue, that is headache, increase the muscle tension or pain in the neck at the base of the skull, and headache is the common problem with the computer users. The most common problem, that is obesity, as they have mental work a lot, but there is less of physical work. So the chances of the weight gain will be more. And due to the lifestyle, they used to have the foods, bakery products, and other fatty items, but uh, they are not doing any exercises to compensate or to burn that calories. So the obesity is the common issue in the computer workers. Stress disorders, so prolonged computer use along with the other factors like poor health, work pressure, job environment. So this all causes the stress to the individual. The most common issue after the obesity and back pain and upper back pain and lower back pain, we have carpal tunnel issues. So carpal tunnel syndrome, it's basically the compression of the median nerve near to the wrist joint or near to the carpal tunnel, and as a result there will be the numbness and pain, sometimes tingling sensations also common, and this pain might get radiates from the shoulder neck area and till the especially in the middle of the night the patient will get awake due to the this type of tingling and numbness type of pain. Another syndrome, that is the GUYON'S canal syndrome. So it is a similar like carpal tunnel syndrome, but here the nerve involvement will be the ulnar nerve, and the main symptoms which is produced, that is in the little finger and in the ring fingers. So this is also the issue which is related to the computer users. Here also, the person is having tingling and numbness type of sensation, and it might get radiate. Another issue, that is trigger finger. So the trigger finger affects the ability of the tendons to slip fro and back. So forward and backward movement of the tendon will get affected, and tendon and or ligament get thickened, and the nodules formation will be same. So as a result, there will be the pain and funny clicking type of sound or sensation will come when the person try to flex the fingers. So how we'll get to know whether am I at a risk of MSD? So just ask these all questions to yourself, that do you perform frequently repetitive motions? Do you bend a wrist or twist while doing the or lifting any activities? Do you use the push or pull objects throughout the day? Do you use any wrong tools in a wrong manner, or while grasping the tools, do you use more fingers? Have you forget to take the break while working, or do you feel that you are in a stress, or do you used to do any exercises during your working hours? Do you do or any relaxation activities in between the 6 months or a 1 year of time? If your answer is yes for most of the questions, then there are the chances that in the future or in the present you may have MSD. So, what are the risk factors which can lead to MSD? Awkward posture or sustained exertion, contact stresses, forces, vibration, repetition of the same motion, then length of task without taking break, and insufficient time of rest, and psychological stress. So, what are the warning signs? If you feel the tension in your back, neck, and shoulder, there is a aching in the hand and wrist, there will be headache, pressure due to the eye strain, awkward posture, using the force or lack of rest can amplify this type of problems. So, are MSD preventable? Yes, they are preventable, but if it is identified early, and the treatment that depends on the stage of the MSD. If the condition cannot be reversed, the treatment can turn into a pain management situation. And if we treat this type of patient, or if we get these early signs, and if we feel that we should proceed for the physiotherapy, then of course we can uh, avoid this type of MSD in the future, and we can reduce the present symptoms as well. So the individuals play a large role in preventing the MSDs. So how we can avoid this type of injuries, repetitive injuries? So for this, we'll study in the next presentation. So for the today, we have learned related to the MSD, what is ergonomics, and what all the main problems that computer users are facing. Thank you.